Hi, Anne Davey here from Massage and Myotherapy Australia. In the next episode of Massage and Myotherapy Connect, I chat with the CEO of Painaustralia, Giulia Jones, and we discuss all about what Painaustralia are up to and National Pain Week. We also have Dr. Niki Munk and Dr. Amie continue their research series and discuss outcomes from PRACI, including some recently published research. Stay tuned. Hi, I'm Anne Davey, CEO of Massage and Myotherapy Australia, and I'd like to welcome our guest, Giulia Jones, who is CEO of Painaustralia. So welcome to the show, Giulia.
Hi, Anne. Good to be here.
So you're very, very new to the role at Painaustralia. So do you want to give us a bit of a background about yourself?
Yes, I feel very privileged to have taken up this role of CEO of Painaustralia. And up until a few months ago, I was a politician, actually.
Wow.
It's a strange way to come to health advocacy. But I guess my life has all been about advocacy. I've worked in the trade union sector. Then I did a strange thing and became a Liberal politician. So I've done a bit of both sides of the fence, let's say. And but at the heart of everything I've always done has been advocacy. And I was Shadow Health Minister during the lockdowns and the really peak part of the pandemic as far as government response goes. And it was very heavy going, and I was looking forward to doing something a bit different after 10 years in politics. So I was really excited to apply to do this work for Painaustralia because, you know, it's 1 in 5 people who live with chronic pain. And we know that the solutions are very individualised depending on what your pain is, what's caused by, and how it affects your daily life. And I think most of us who've been on this planet for a while have experienced some significant pain. And I'm no different to that either, with an injury from my childhood as well. So I'm really, I feel very honoured to be here in the pain advocacy space. And I think that there's a lot more information to get out to people, and there's a lot more that governments can do to assist us. And that's what I'm here to try and achieve.
Oh, that's perfect. And that fits in with Massage and Myotherapy's strategic plan, which leads me to the partnership that we've developed over the last couple of years, 12, 18 months, I think it is, where Painaustralia has partnered with Massage and Myotherapy Australia, and you've got some of our fact sheets on pain management on your website, which is fantastic.
Yeah, yes. As a peak body for pain, we take great pride in having a very thorough website, which has information on lots of different options for people, because we know that types of therapies are the best way for people to find what works for them. And so we're very pleased to have that partnership with Myotherapy and Massage Australia so that we can have all those latest information available to the public through our website.
Yeah, and your website is
painaustralia.org.au. Very easy.
Yes, so we urge our viewers to go and have a look, because there's possibly something there that they don't know, or somewhere they can refer their clients to.
Yes, and we also have the National Pain Services Directory for the top tertiary clinics, which include allied services, but in a setting of a tertiary health clinic, right at the top of the tree for those who really need that intense high-level medical specialist support. But we will be growing our information as well on the website about, let's say, less intense and expensive options, which is where we do something similar but self-organised, And one of the messages we're trying to get out there a lot at the moment to people is get your health professionals to talk to each other. So in the setting of a pain clinic, they are working together. They'll have conferences to make sure that each client is getting all the different things that they need. when you're out in a community setting and you're seeking allied and GP and maybe some sporting assistance, training and so on. If you're trying to get your body into the best place it can be, you need those professionals to talk to each other. Which muscle group are we working on? How's it going? How can I prepare myself for massage or for exercise in a way that my body can take it the best way? So there's getting your health professionals to talk to each other is really important.
Yeah, and we totally agree with you. And we actually have a campaign at the moment with our members where we're basically educating them in how to speak to GPs and and allied health practitioners for the benefit of their clients who are, for any reason, not necessarily just pain, but pain is one of the forefronts.
I mean, asking your health carers to email each other is something that lots of people don't know they can do.
Yes, exactly.
But it can make your pain management much better. So I really do encourage, just give it a go. Ask your pain specialists or your massage therapists or your myotherapist to keep in touch with your physios, with your exercise physiologists or your trainers, with your GP. And that just means that the flow of information, and you can ask to be copied in so you know what's going on, and that really can make a big difference to people.
Yeah, and then they get that bespoke that suits their needs.
Correct.
Absolutely. So what's on the horizon for Painaustralia? It's National Pain Week next week, yes?
Yes, so we're starting National Pain Week off with a launch on Monday. And I really do need to shout out to Chronic Pain Australia every year who put the events for National Pain Week together, Fiona Hodson and the team there. They're a great group of people who do what they do on top of their day-to-day jobs. And look, National Pain Week is an opportunity for us to highlight the 1 in 5 people living with chronic pain in Australia and what their needs are. And we find it's not changing a huge amount. I guess it's like a lot of the changes that we're trying to bring about in society. It takes years, it takes decades. But I think from my perspective, the most important thing is for us to encourage people to talk about their pain and to be confident to discuss it. There's a lot of taboo and stigma associated with being in pain. People can tell you that you're making it up or that it's not real or it's in your head. And while the head does play a part in the signals that our brain produces for our body to produce the pain sensation, it's very real for people, and I don't think many people would make it up. So,
no. And that's a high statistic, isn't it? 1 in 5 people living with chronic pain.
I guess we're living longer and we're using our bodies hard. Some of us sit all day, some of us are standing all day working hard. And I guess we're becoming more aware of pain in our community, and that statistic's really important. Now, it's not that 1 in 5 people are completely debilitated by their pain, but some might be like me. I've got an injury, a tailbone injury from when I was young, and some days it's not a problem at all, and other days it's a terrible problem. And but it's real, and it's an impact on my life, and I have to account for it if I'm sitting for a long time, for example. So we really want people to speak about their pain. Some very young people are in a lot of pain, whether it's pelvic pain, whether it's fibromyalgia or another condition, a nerve condition. If you talk about it, others will understand it better. And it's a social change we need to make, a bit like the mental health discussion of the last decade.
Yes,
is bringing pain out from the shadows and allowing people to be free to discuss their pain.
So National Pain Week kicks off on
Monday
the 25th of July. So so anybody that's interested, just go to your website and see.
And have a look at Chronic Pain Australia as well, who are the lead in the National Pain Week activities, and they will be broadcasting live on Monday the launch of Pain Week.
Fantastic. All right, so thank you for your time today. It's really great to have a chat, and we'll continue the partnership for the benefit of our members and the community at large. And we look forward to working with you in the future.
Well, I just want to make a little message of thank you to all the massage and myotherapy professionals out there. We rely on you. A lot of us rely on you to continue with our lives and to live our best lives. So I know your work is physically hard, and and you're very committed to it to do that for your careers. And thank you so much for what you're doing for the 1 in 5 Australians living with chronic pain.
Awesome. Thanks for your time, Julia.
No worries.
Hi, everybody. Dr. Niki Munk here. I am the MMA Fellow for Arkham's Leadership Program and also a massage therapist and associate professor at Indiana University, the School of Health and Human Sciences. In health sciences in the department chair, I do research with massage and pain. And I am joined today with Dr. Amie Steele. Hi, Amie.
Hello, Niki. Yes, just reminding everybody, I'm the Senior Research Fellow from Arkham at University of Technology, Sydney, and I'm the Chief Investigator for PRACI, the Complementary Medicine Practice-Based Research Network here in Australia.
Well, and we're going to be talking today, continuing the theme of PBRN and PRACI, because now we're going to join those two pieces together, and we're actually going to talk about a study, a paper coming out of a study that was conducted within the PRACI network. So I'm going to go ahead and share my screen because I've put some slides together for us to talk through. Here we go. Amie, can you see my screen? There we go. Now we can see. All right. So I put this slide together just as a reminder of the various different ways that massage clinicians could be, well, anybody, but massage clinicians can be engaged in research. So I have our 5 different areas that could be a research consumer. So this is looking at, basic research literacy. They can be a participant in research. They can be one who is actually providing the intervention in a clinical trial for massage. They can be a number of different pieces within the research enterprise, either as a research assistant or coordinator, doing all the manner of different tasks related to the writing or data collecting or recruitment of subjects. Or they could actually be a lead investigator. So things like designing the study, implementing the study. So there tends to be other education that is involved with this. But for our purposes today, in the article that we're going to be talking about, we have 2 key areas that our massage therapists are involved in the research enterprise. So we have the lead investigator for this particular study is a massage clinician, and then also the research participants are massage therapists as well. So the study that we're going to be talking about comes to us from Sarah Fogarty, and also just have to note that Dr. Steele was also a part of the study, and then also Helen Hall and Philippa Hay. It was published in 2020, and you're able to access this. If you go to Google Scholar, you can look up the citation, and it's published in the Complementary Therapies in Clinical Practice. So very quickly, we have an overview of the design and the methods that were used in this. The key piece, of course, is the research question and what is the objective of the study. It's a survey study that went out to massage therapists within the PRACI network, and it was asking about the practices of those who provide the preconception, antenatal, or postnatal massage. So getting information about what people are doing in their practice. And then they were also looking at people's thoughts about that, and then their confidence in the different areas that they were working in. We have a flow chart here, and you'll see this in many research studies, a flow chart of how many folks were recruited, and then how many people were included in the analysis. And so we see that while 151 people started the questionnaire and started the survey, only 99 were included in analysis. And we have the reasons why folks were excluded from that. But things to note, the data was collected within a 2-month time period, and this data was collected pre-pandemic. We had there were 3 sections within this survey, and it ended up being 66 total questions, and then it was broken down in demographics, then asking about the participant characteristics within their clinical practice and what have you. And then also talking about the 3rd section was about the clinical management within that massage application for those who were either pre-pregnancy, during pregnancy, or post-pregnancy. So the next several slides that I have are breaking down the key tables here. And so the first table that we have is the demographics table. So what you're looking at are the different characteristics of folks, and then you have the frequency, or in the case of age, you've got the mean age and the standard deviation, but then we've got the frequency and the percentage here. And then the thing to note here, I would say, would be the proportion of folks. We've got a nice representation of those who are in rural settings, which is really nice. It might be a little bit higher than what the population, if I'm not mistaken, Amie, a little bit higher than the population, but this might be.
Yeah, I think so. I think one of the things it's worth noting, I guess, is you'll find a lot of research papers have got a table like this as the first table, and it's kind of showing the reader who was involved in the study. And this is really helpful because there might be certain elements to the results that are a little bit influenced by who was involved in the study. And so in some instances, it might be, oh, this is just demonstrated is representative of the profession. And I think the massage therapy profession in Australia is, more than a good proportion of them are female. So the fact that we have more female respondents is a good indication of that. But maybe we have a bit more than the average, the normal proportion of female in this mix, and that's probably might be because of the topic, and that maybe female massage therapists are more interested in the topic. But yes, the rural and remote is another thing to think about. Well, I think we have it might be slightly greater, and certainly we know that people in rural and remote locations use complementary medicine more because they don't have access as much access to other conventional health providers. And so people in those locations might be more likely to deal with slightly different conditions than massage therapists in urban locations, because the people in the rural and remote areas just don't have anyone else to go to for them. So they go there in the hope that they can get some help. So it's nice to have a bit of an idea about who the people are who've answered the survey, because that might influence the results of the other questions a little bit as well.
Absolutely. Well, and I think to your point too, around people in rural settings might be going and seeing the massage clinician for even more than what those in the urban setting might be treating folks with. Mm-hmm. And we also see on the right-hand side of the table are all the other health-related qualifications that these massage clinicians also held. So yeah. Oftentimes the massage clinician training is on top of other training that they may have, or they may have other collaborative or complementary training in other healthcare pieces. So we could see all those different areas here. Yep. All right, so that's just telling us who it was that were participating. In our next slide, so what we're looking at here is the different areas that folks were asked about. We have the percentage of total clinical practice time within the week that the clinicians who were responding dedicated to these areas. But you'll note that not everybody within pregnancy massage, we have the 96%, so a really high proportion here that were doing this. But then we can see the amount of time, the average amount of time per week that they're dedicating in their clinical practice to work with their pregnant clients within those different trimesters. But then over here, what we see is we're seeing this confidence score. So for each one of these areas, the massage clinicians were asked how confident they are in providing that care. The scale was a 0 to 100, 100, the higher number equaling greater confidence, right? So, but we have this broken down in two ways. We have the initial training. Well, here's the confidence is here. And then over here, we're asking them if they had training in their initial training in that area, or if they took training later after their initial training. So this is what we're looking at with this particular slide. We and see I think,
sorry, I just was going to say, because I think one of the things that was really important for Dr. Fogarty, who was the lead for this study, was, and it's one of the nice things about having a massage therapist leading the study, is that she was just as much interested in what can be done to help support the massage therapy profession, as well as actually getting information about massage therapy to communicate to other people. And so understanding, for example, if there's gaps in training was really an important thing for the research to identify. If there are people who are providing training in some specialized areas who maybe haven't completed a course, or where they might have undertaken their course, and if there's areas that they're maybe not feeling quite so confident, then that helps to feed back into the profession to think, well, what can we do about that? Do we need to offer more training? Is the training that we offer, you know, robust enough to give people confidence to provide that sort of care when they come out? So I think that this is, and that's what you can see here, that, and obviously the majority of the people who responded to the survey said that they had pregnancy, doing some sort of pregnancy massage, which is probably why they chose to respond to the survey, because that's what it was about. Of course, there's a lot less doing labour preparation massage or massage partner training, but even and that's an interesting thing to identify. Well, if some of those practices or therapies have got some real value for the community, then what can we do to support people, you know, massage therapists doing more of that if they want to?
Well, absolutely. And we can see also with these confidence scores, the areas where there's less confidence in the massage clinicians in that area. So we see very clearly that, you know, pretty good confidence within the first, second, and third trimester, and performing that. But there's less confidence in things like the massage to help folks who are going through fertility treatment, or and then also in the intended to stimulate labor. So less confidence in these types of areas. And then we also have down here below other pieces that might be complementary, or other topics and timings around pregnancy that massage might be engaged in. So IVF support, those who have experienced miscarriage or stillbirth or natal loss, and then also depression and anxiety with or without postpartum pieces.
Yeah.
So the so this is a really big table of results as well. So let me just break down really quickly what we're looking at. So again, we have the same categories here to the left, but now we have the type of training and whether the respondents do this kind of work, and then whether or not they have training. So they provide the massage with training, they provide the massage without training, they don't provide it and they don't have training, and then they don't provide it, or they don't provide it but they have training, and don't provide it without training. So this is just their conceptions about whether or not this should be done, and then the confidence within each of those categories here.
And I found this table really interesting because, you know, going back to the previous slide that we had, where, you know, there's about 39 out of 100. If people, because that scale of confidence was a 0 to 100 scale. So if people are rating themselves at 39, then they're saying they're on the lower side of confidence as an average for all of the people who responded. But when we look at it in more detail and saying, okay, so if people have been trained and are providing the service, then their confidence is much more like 88%, or, you know, out of 100. And in fact, but the people who are not providing the massage without training are 23%. But of course, there's a lot more of them who aren't providing the massage and aren't trained. And so that's probably pulling that overall average down. So this is actually giving us a little bit more insight into what impact is the training having on the confidence. Do we need to fix the training? But what's interesting here for me is the number of people who are providing the massage without training. Now, I'm not a massage therapist, so I'm not sure how important having training in some of these specific areas are, such as stimulating labor or fertility massage. But it's interesting to me that there's the people who are providing the massage without the training are still feeling relatively confident doing so. Although the massage to stimulate labor, the confidence gap is much bigger between people who have and haven't been trained, I notice.
Yes. So here's the last, there's many tables in this paper, and I have an outline here of the other ones that are showing up. So if you have interest in these areas, like the referrals from other healthcare providers to the massage clinician, and then the kind of referral patterns from the massage clinician to other healthcare providers, the different techniques and things that are taught in these different areas of pregnancy related massage, and then the areas of the body that are being avoided, And then also just the different conditions and areas that are being focused on in the massage. These tables here that I do pull out are the number of treatments that folks are doing within their, let's see, this one is number of treatments provided. Right, so within their care.
Number of treatments they're providing, sorry, Niki, I'll just jump in because I know I was a bit more involved in the study, but it's the number of treatments, average number of treatments that the participants said that they provide when they're treating these providing these types of massage. So on average, people who are providing fertility massage are giving about 4 treatments or sessions per client. Whereas people who are doing massage partner training for labour are giving 1, possibly up to 2 training sessions per client, but more closer to 1. And so that's what that mean value is. And one of the great things about this, and even in terms of some of these other tables that we've seen, is not only does it help us understand a bit more about what can be done to help support and strengthen, massage therapy for this really important life stage, but in terms of the delivery of care, training for the profession, all of those things. But it also helps us to drive future research in this area. So some of those patterns that I picked up on the last page, we don't really have answers to why it is they feel more confident here and less confident there with their training or without training. But that's an opportunity for us to research this more. And one of the things that comes out of research like this is what we call hypothesis generating research. So it allows us to identify new questions we didn't even know we should be asking, and that's why you often see a conclusion at the end of a research paper of more research is needed, not because we're trying to keep ourselves busy as researchers, but genuinely because research commonly raises as many questions as it answers. Particularly if it's in an under-researched area. But also one of the things that this sort of research provides is if I was looking to do a clinical trial in massage therapy and I was designing an intervention, it gives me a bit of an indication based on people who are on the ground doing this research regularly, that if I wanted to provide therapeutic intervention for a clinical trial for participants, for women who are undergoing some sort of fertility support or having issues with fertility, I would want to make sure that I've got about 4 treatments sessions built into my intervention, because that's what the people who are commonly providing that sort of care are saying is the average amount that you would expect to provide. So there's lots of benefits to this sort of research to informing both the profession and future research.
Absolutely. I'm going to go ahead and stop sharing my screen. But we encourage you guys, if this is of interest to you all, there's several papers that on this topic actually that Dr. Fogarty has been working on. And I'm not sure if I mentioned this or not. You've alluded to it, but Dr. Fogarty is a massage clinician. She's a practicing massage clinician, and she's had the additional training to lead up research studies like this. But it's really, she's one of the few massage clinicians that have gone and done that extra step for that training and is doing quite a bit of research in this area. So we encourage you guys to look this up in addition to other research that's coming out of Dr. Fogarty's area and other pieces that are coming out of the PBRN. So maybe we can do another one at another time, Amie.
Yeah, I'd love to do that, Niki. That was really fun.
Yeah. All right. Well, we'll see you guys next time. Thanks for joining us.
See you next time.